As far as diet goes, I would say a lot of what we focus on for postpartum moms is appropriate protein intake because tissue healing can be very, very important, and that's whether patients have had a vaginal delivery or a cesarean section. Another important aspect is making sure that caloric intake is adequate. A lot of our moms have the goal of breastfeeding, and breastfeeding is something that we really try to support any way that we can. So although a lot of moms are looking forward to returning to pre-pregnancy weight, something that is important to remember is that crash dieting immediately postpartum is not recommended, particularly if your desire is to breastfeed. So this involves both adequate nutrition, so a rough split between your proteins, your carbohydrates, and your fats, as well as adequate fluid intake, particularly water. A lot of patients don't realize that you need to maintain the high levels of fluid intake that you previously had in pregnancy to support breastfeeding. As far as activity restrictions, this varies a lot depending on the type of delivery that a patient has had. Certainly, we encourage patients to be up and mobile after delivery, and that's whether they've had a C-section or vaginal delivery. One of the reasons for that is that patients who are postpartum are particularly at risk for deep vein thrombosis and pulmonary embolism. One of the ways that we prevent that is making sure that patients are getting up frequently and stretching their legs, and that's both in the inpatient setting and then once patients go home. So it's generally not recommended that patients be sort of bedbound once they get home, but are certainly getting up and moving. Beyond that, like I said, it varies depending on the type of delivery you've had. Certainly, if you've had a vaginal delivery and you're feeling up to it, you can engage in low-level aerobic exercise, things like getting out and taking a nice long walk if you feel like it. Of course, the recovery for cesarean section is a little bit longer. So a big part of that is, listening to what your body is telling you. One of the restrictions that C-section patients have is lifting restrictions. So we generally recommend against lifting more than 10 pounds until you get clearance from your physician. So a good rule of thumb, you can carry your baby in their car seat, but nothing heavier than that. And for some babies, that's probably closer to 20 pounds, but we grant that. Other restrictions, certainly activity-wise, we want to discourage patients from engaging in sexual intercourse until they have been cleared by their physician. But otherwise, you can treat yourself basically as a normal person. Of course, this all varies from patient to patient depending on the circumstances of their delivery. For our patients who have had a cesarean section, incision care is extremely important. Number one, patients and physicians want to prevent surgical site infections. One of the ways that that's prevented in the hospital is adequately cleaning the site prior to your C-section and giving you what we call prophylactic antibiotics to prevent an infection. So you want to keep your incision clean and dry at all times. Certainly we encourage bathing, on a daily basis. And if you notice that your incision is any way oozy or has any fluid around it, you want to make sure you're cleaning that incision just gently with a plain bar soap without fragrance. And you want to make sure you pat it dry afterwards. Generally speaking, as far as the incision goes, things that you're looking out for, incisions that are draining fluid, particularly cloudy fluid that appears like pus, incisions that appear reddened or particularly swollen. These are all warning signs, and you should contact your provider to come in and have an incision check if you're experiencing any of these problems. For our patients, both breastfeeding and non-breastfeeding patients, breast care is very important postpartum. Certainly for the patients who are breastfeeding, we want to make sure that prior to breastfeeding and after breastfeeding, they're cleaning the nipple with a plain soap and water just to make sure that any dried milk is removed from the area. If a patient experiences cracked nipples or nipple pain, first of all, we want to make sure that the latch of the baby is adequately assessed. This is often done inpatient, but a lot of the trouble that patients run into can happen in an outpatient setting. We want to remind patients that our lactation consultant is available to them even after they leave. And indeed, this individual oftentimes sees patients who are coming back into the hospital to assess this. If a patient does experience cracked nipples or a painful latch, we want to make sure that the patient is applying lanolin after breastfeeding. Things such as nipple shields can also be helpful. And sometimes even in between feedings, applying Eucerin cream or a Vaseline to the nipple can keep the nipple lubricated, because that can be a major reason why patients discontinue breastfeeding is in the event that they experience cracked nipples or pain. So anytime we have a patient who's experiencing excessive pain with breastfeeding, we want to make sure we assess that. And this also ties into the potential risk of things like mastitis postpartum, which is common. So if a patient experiences breast swelling, tenderness, and fever, we want to make sure that that gets assessed as well, because that may necessitate a course of antibiotics to make sure that they're doing okay. So postpartum, there are medications that are commonly prescribed to patients. Generally speaking, we want to make sure that patients are continuing on their prenatal vitamins. In addition to this, majority of patients actually go home a little bit anemic. So it's quite common that your physician may prescribe you supplemental iron. It's important for patients to know the level of their anemia when they go home, so they can be looking out for warning signs and symptoms. Things like dizziness, chest pain, shortness of breath can be signs of severe anemia. You want to make sure you contact your provider if you experience any of those. Because of the iron in the prenatal vitamins, constipation can be quite common. So your physician may prescribe you Colase, which is a stool softener that helps have nice, smooth bowel movements. Pain medications vary from patient to patient. Commonly, ibuprofen is given for vaginal deliveries as well as C-sections. The additional medications given for C-section vary from provider to provider, but I think a general rule of thumb is that the ibuprofen can be used as a medication for baseline pain control. So at least in those initial days once a patient gets home, it's helpful if they take that medication as prescribed around the clock, just to provide them a little baseline relief. And then they can take whatever their narcotic pain medication is if they have additional pain on top of that, to make sure we're staying on top of that pain once they get home. Postpartum depression is a very, very common complaint that patients have, and it affects roughly 1 in 4 patients. Now, this can come in the way of what we call postpartum blues, and that's just the transient feeling of being overwhelmed, being overly tired. But what we're trying to suss out when we assess patients in the office is those patients who are having these feelings on a persistent basis. So day to day, they're having more times that they're feeling down versus good. Being a new mom is incredibly stressful, and that's whether it's for the first time or whether you're trying to integrate a baby into a household where you already have kids. Something that is commonly done, it's quite likely that when you're seen postpartum at your first visit and in subsequent visits, your physician may have you complete a questionnaire that assesses you for postpartum depression. But it's always important to reach out to your physician if you notice that you're feeling particularly down, that you're having difficulty completing a lot of the daily tasks you need to do as far as self-care or care for your baby, or certainly if you feel yourself heading in a direction where you're fearful you might harm yourself or someone else. When you are discharged, you will have a discharge instruction sheet that lists a lot of these warning signs. Generally speaking, things that we're concerned about are excessive bleeding. So what we consider excessive is greater than 1 pad per hour over 3 hours without cessation of bleeding. That can be a warning sign. Postpartum bleeding is normal and can last up to 8 weeks, and it can appear as heavy as a heavy flow, but it will normally vary from day to day. So we're looking out for those patients who have persistent bleeding on a day-to-day basis that isn't sort of letting up. Certainly tied to that, as previously discussed, Anemia is a concern, so if patients experience chest pain, shortness of breath, severe dizziness when up and moving around, that's a reason to contact a provider. Certainly if patients have a fever, that's a reason to contact a provider. So we consider a fever a temperature greater than 100.4. A lot of patients can have a transient fever with a letdown of milk for those patients who are breastfeeding, but usually that temperature doesn't reach 100.4. It's helpful for any patient to have a thermometer on hand, so if they're feeling a little bit feverish, they can check their temperature if necessary. Certainly for our patients with C-sections, incision care, as we mentioned, is important. If the incision becomes particularly red, if it becomes swollen, if you have any drainage of cloudy fluid from that incision, that would be a reason to contact your provider. If you notice swelling to one or both legs, that can be a sign of deep vein thrombosis. That's another reason to contact your provider. And certainly if you have any signs of or symptoms of severe postpartum depression or anxiety, we want to hear from you. Follow-up can also vary from provider to provider. Generally, the standard of care is most physicians will see the patient 2 weeks postpartum. If you have a C-section that was closed with staples, it will probably be 1 week postpartum for staple removal. And then we have an additional visit, normally it's 6 weeks postpartum. Those visits are slightly different, but they have the same goals. Number one is assessing how moms are adjusting to having the baby at home, checking for any signs or symptoms that are worrisome, and assessing need for birth control in the postpartum period.